As much as when you're in the hospital, you value what's being done for you and all of the people who are working in your care team, they're strangers. They're not the people who can really make you feel better. That comes from my family, the people who are important, my friends, are gonna love me and accept me and help me through this, because those are the people who make up my life.
What if it was your family member? If they were here, wouldn't you want to be there for them as much as you could? You know, if that meant staying overnight and they wanted you there, I'm sure you would want to be there. Physically being there and knowing that we're here no matter what, and whether we can actually do something for your medical situation or we're just present, I think that meant a lot for our family and for him in going through this.
And you've gone to sleep by yourself in the hospital and you wake up and you're in the same situation, then often you have to wait until 5 o'clock in the afternoon for somebody to come visit you. And when you're completely stuck in your bed like I was, I couldn't even use a wheelchair. There's really nothing. You're in your room, and that's lonely.
I was really happy to find out that what I thought was going to be an entirely patient-centered policy turned out to be just as much a staff-oriented policy. That we got so much feedback from staff, and we really paid attention to what their issues were and what their needs were, as well as the patients. And the wonderful part was that they worked together.
If we need quick access to the patient, to the IV pump, to the monitor, and our rooms are a little bit smaller, then we might have to ask them to step out just because we need to have that quick access and the room to be able to kind of move around.
We'll ask them certain questions, where you're going to go to, let the staff on the floor know that you're coming. Okay, so therefore you can have a nice easy flow from where you are to where you need to be. We're here to maintain a tranquil environment, so our department is available 24/7. We try to have a process where we're there less than 3 minutes for a very urgent call. Sometimes less than that because we're patrolling the facility.
This has been the hardest time of our whole lives for our family, and for somebody to support that and kind of encourage and value the family network and being there for Paul just meant so much. And I still reflect and think of those people in my mind, and they really made a difference.
Having somebody just make you that priority and be there beside you and just be willing to do that, whatever you need. And if you need to sleep, them accepting that and just sitting there. At a certain point, it's just hard to accept yourself as a patient day in and day out, and to have your family coming and being around you and reminding you that you are more than a patient, and that's what you're striving for when you are in the patient population, to not be a patient. They're the ones who keep that foremost in your mind.